I'm Dr. Rick Greene from the medical school class of 1970 here at the University of Virginia. And it's my pleasure to host this series of interviews with noted emeritus professors at the university for our Alumni Association. So it's my great pleasure to be talking with Dr. Bob Chevalier today, who is emeritus professor, chairman of pediatrics. And so welcome.
Thank you.
It's nice to see you.
Likewise.
Tell me a little about your background in getting to Charlottesville, getting to Virginia.
Well, it's a bit of a circuitous path. I was born in Chicago, but taken to Europe when I was 2 months old, just after the war. It was in 1946, and moved to Antwerp and spent 2 years there, then 8 years in Rome, and then 5 years in Geneva. Came back to the States when I was 16. Moved to Chicago and then enrolled in the University of Chicago for college and med school. After that, I wanted to see different parts of the world, and I decided to do my pediatric residency at UNC Chapel Hill. Really liked the southeast area, did another fellowship in Denver, and then looked for opportunities back in the Middle Atlantic area, and there happened to be a job at UVA, and there were no pediatric nephrologists here at the time, so I chose coming and being the one and only pediatric nephrologist, which I was advised not to do, but it turned out to be a great opportunity.
I think you work with Dr. Gottschalk.
I did, yes. Carl Gottschalk was my mentor at UNC.
Right. Mentorship is so important. Give us a little flavor about your approach to mentorship, and especially at the university.
Well, I think the university really offers a huge opportunity to be a mentor and a mentee. The collegiality of the university is really, I think, its primary characteristic. So I think it's really facilitated mentoring, and I think the opportunity to help, aid, be there for trainees, whether they're undergraduates, graduate students, residents or fellows or colleagues, is one in which you take pride and pleasure in the success and advancement of the people you're working with. And it really is a two-way street. It's very enriching to hear questions, particularly from the younger trainees who don't know too much about the field, but sometimes ask the best questions. And it really is more of a dialogue than a dictatorial operation.
Tell me a little about the effect of your international background. I mean, obviously, you've traveled widely. How has that affected your career, especially now that you have more time to do some of these things?
Well, I've always maintained my ties to Europe particularly, but around the world. And one of the opportunities of academic medicine is really traveling and meeting and working with colleagues around the world. So I've taken that opportunity to travel as a result of my research and my clinical job. And I think having that perspective is one that really enriches what you do in the lab. The collegiality of UVA is such that even though I was in the Department of Pediatrics, and I still am as an emeritus professor, I really work closely with people in other departments, other schools across grounds, and then internationally. And of course, you can't not mention Thomas Jefferson. He was a great proponent of international relationships, particularly France, which happens to be the place I'm most familiar with.
Tell me a little about what you're doing outside of medicine today.
Today? Well, now I still maintain my office in the lab, and I go there several times a week. I continue to mentor junior faculty members, attend conferences, grand rounds, etc., research conferences, clinical conferences. And so that's my interaction at UVA. I'm also active in my societies, pediatric nephrology societies. And since I retired, I've become more interested in the history of medicine, so I've joined the American Association for the History of Medicine. And I'm also a bibliophile. I've been collecting books for decades. And my wife told me that if I don't start getting rid of some of my books, I'd have to figure out a way to something to do. So I started an internet-based rare book shop in medical books. That's something that my mentor Carl Gottschalk instilled in me. He was a great book collector too.
You know, it's amazing. My wife has told me the same thing.
Oh, is that right?
I've recently populated some libraries
Yes.
of some of the UNC students
Oh, really?
that I teach who come to Charlotte.
Yeah.
So medical history is really something that you've been heavily involved
All
in.
along, yes.
Yes, that's wonderful. Have you done any type of global medicine work?
Well, I've been a member of the International Pediatric Nephrology Association. I was on the council for a number of years, and getting together with colleagues around the world. I've not really been directly involved with clinical work, but more in the teaching, going around and giving seminars, talks, workshops with faculty and trainees around the world. I was visiting professor for a week in Palermo, Sicily a few years ago, which was really interesting.
I take it that being in Charlottesville still has a pull. You haven't
Absolutely.
gone back to Chicago.
No.
With the weather in Chicago.
Right.
What is it about living here around the university that really grabs onto you?
Well, there are a number of things. The other thing that I didn't mention before about retirement is my wife and I are very involved in the arts here. We're both on a number of boards and are both interested in music and the visual arts. And we have a very rich cultural environment here, particularly given the size of the town. But the university is really the heartbeat of Charlottesville, and to be in a great university where the quality of life is so good, and yet to be near large urban centers, I find is ideal. So, and again, the university itself, the word I always share with our intern applicants and anybody else that we're trying to recruit is the collegial environment of the institution, where you don't sacrifice excellence for a really civil environment.
What do you tell to a young medical student who's maybe in the second year, third year, they're trying to decide on a career? Obviously, your career has been so good for you. It's been very specific in an area of pediatrics, but in a general way, how do you mentor somebody? How do you recommend what to go into to medicine? What do you tell them today?
Well, I think you have to follow your passion. That's the main thing. The channeling into medicine, in my case, I was interested in the life sciences from the time I was young, and it was a matter of sorting out whether I wanted to be a biologist or a physician. And I like the social aspects of medicine, so that you can meld biology and human biology and really be aware of your community of people. And then I was attracted to pediatrics because I was interested in embryology, development, maturation, and change that people go through over time. So I think it's a matter of being in tune with yourself first, and then taking the opportunity to interact with as many people as you can. And I think another one of the benefits of UVA in pediatrics, for example, we have a medium-sized department of about 100 faculty now, but we do have representation in all 12 or so divisions of pediatrics, so that a graduate coming and starting an internship here will be exposed to all the subspecialties, and the senior faculty, the division heads, have excellent connections around the country to get them into a good fellowship if they choose to go into practice. About half of our residents go into practice, half into academic positions, so it's a nice balance.
Well, I can tell we've been very fortunate to have you, Bob, on this faculty at the university. We've been talking with Dr. Bob Chevalier today from the Division and Department of Pediatrics, pediatric nephrologist. And again, I want to salute you for being such a wonderful person and a great emeritus professor. Thank you.
Thank you.
My pleasure.